Good afternoon. My name is Brent Bonner, and today I'm going to discuss with you the layout you see before you, and it is entitled Operation OR. I created this model in hopes of providing a better understanding of what is needed to create a successful operating room. I hope that you find that this is thorough explanation of the layout that I am presenting to you, enjoyable and informative. There are many essential employees in the medical health field. Thousands of employees work in the hospital, but most essential for our purposes are the following. Surgeons. Surgeons are the main ingredient in any successful operating room. They are specialized physicians who are responsible for performing the procedures on patients. They carefully plan out their procedure step by step, utilizing all the education that they have learned. Surgeons must discuss all options with the patients before the procedure to explain what will happen while in the operating room. They must also follow up with the patient after the procedure and continue post-op care once the patient is discharged from the hospital. Surgical physician assistant. The surgical physician assistant is responsible for assisting the surgeon throughout the procedure. Normally, this would be a resident or a physician assistant. They must have extensive knowledge of the procedure and able to assist the surgeon in any situation that may arise. They are also a key part in discharging patients from the hospital. The anesthesiologist. The anesthesiologists are responsible for sedation of the patient and monitoring vitals. They must make a preoperative assessment of the patient to determine what medications would work best for the patient. They must make sure that pain is controlled. Vitals remain stable and they stay under sedation for the procedure in its entirety. After the procedure, the anesthesiologist follows up in the PACU to ensure that there are no adverse reactions to the anesthesia. The surgical scrub technician. The surgical scrub technician is responsible for ensuring that the entire operating room is sterile and that all appropriate tools are set out, sterilized, and ready for use. The surgeon to use. The surgical scrub technician's responsibilities are great as they are responsible for making sure that the surgeon has everything that they may need and keep the procedure running real smoothly. They're also responsible for handling instruments to the surgeon or the physician assistant during the procedure. The circulating nurse. The circulating nurse is responsible for everything that involves readying the operating room, such as counting all instruments before and after a procedure, monitoring vital signs during the entire procedure, and ensuring that the correct patient is in the room, acting as a liaison between the patient and the surgeon during the procedure, to following up with the patient care post-operatively. The circulating nurse is also responsible for documenting everything that happens during the procedure. The X-ray technician. The X-ray technician. The job of the X-ray technician is to shoot X-rays when the surgeon requests them. They also assist in moving patients when necessary. When the technician follows the rules and procedures of the OR, the procedure can be performed smoothly and efficiently without any pause. When the technician fails to follow procedures and guidelines, the procedure can be delayed and cost the hospital unnecessarily. Error in the operating rooms can have a significant impact in the efficiency of the operating room. Point your attention to my flow chart. For an example, if an X-ray technician were to break the sterile field, the operating room would have to be reset, and this would cause delays in other procedures and cost the hospital over $700 just to re-sterilize the operating room. It is very important of X-ray technicians to be sure that they do not break the sterile field and that they make sure equipment is placed properly before the room is sterilized, as to avoid this costly mistake. If you would turn your attention to the far side of our board and our OR model, I will explain to you the different components that make up a successful operating suite. The C-arm. The C-arm is instrumental in assisting the surgeon during his procedure. It takes X-rays and converts them into fluoroscopic images on the C-arm monitor, and this allows the surgeon to see vivid detail the area that the surgeon is working on and how the procedure may be coming along. The C-arm machine allows the X-ray technician to manipulate the machine at any angle to take images as needed by use of the rotating joint that turns the C-arm either AP or either lateral, depending on the surgeon's preference. These images are then converted into a visual image displayed on the adjacent C-arm monitor. The important features of the C-arm are the X-ray tube, the image intensifier, the rotating joint, the control panel, the charge coupled device camera, the CCD, and the display monitor. The X-ray tube allows the X-ray to be taken while the image intensifier, along with the CCD camera, work together to transform the picture into a high intensity picture that then appears on the display monitors. Crash carts. Crash carts are imperative in the operating room. Unfortunately, in the operating room, patients' hearts or lungs fail them. These carts have on hand every medication and tool that is needed to resuscitate them and hopefully continue with the procedure. On a crash cart, you can expect to find a defibrillator paddles, IV tubing, fluids, instruments to intubate the patient, and medications to successfully resuscitate the patient. Surgical tables are a necessity when doing any procedure. The surgical tables are a necessity when doing any procedure. This bed allows you to move the patients to manipulate patient's position, whether it be turning them side to side or moving them up or down. In order to efficiently perform the procedure. The powerful LED lights allow the surgeon to properly visualize the operating field. Without these lights, surgeon may have a more difficult time viewing entire area that they may need to see. These specialized lights are manipulated so that the surgeon is able to move them wherever they need it to be. Medical supply cabinets. The medical supply cabinets hold any and all supplies that may be needed to perform the procedure. It contains many necessary consumables. Inside these cabinets, the instruments are prepackaged and the tools inside the packaging are sterile. This is important because of if the surgeon needs a tool that is not out, it can be retrieved without breaking the sterile field. Surgical scrub technicians are responsible for setting up this next important instrument, which is the Mayo stand. This very sterile field is where all of the tools that are necessary for the procedure are placed, which are scalpels, forceps, and operating scissors, just to name a few. Next, this monitor here is utilized by the anesthesiologist to maintain vital signs and ensure that the patient is overall stable. These monitors measure the patient's blood pressure, pulse ox, respiratory rate, and rhythm. It is also measured that the cardiac output is sufficient in the patient. The anesthesiologist must sit near the monitor to be able to watch it very closely during the entire procedure. Cost of running an operating room. The approximate cost of running the operating room is reportedly at $8,873 per day. Breakdown of this approximately is $92 per room per hour. The price can be broken down into 5 different categories to better understand where the money is being spent. Capital expenditures. This includes all of the surgical equipment that may be used during the procedure. This includes lighting, monitors, and x-ray machines. The estate. This part is the actual building and utilities that are used on the operating floor. It can include water, electricity, laundry, and phone services. The clinical support. This is the payroll of every essential person that is on the floor working in the operating room. Non-clinical support. This is the payroll of housekeeping, patient escorts, customer service representatives, and clerical staff. Consumables. These are all disposable products that are used daily in the operating room. Consumables includes gloves, drugs, sutures, syringes, and other equipment that will be disposed of when used. I hope that this presentation has educated you on the important components of the operating room, as well as essential staff that is needed. As you can see, there are many different moving parts that, if put together correctly and efficiently, allow the operating room to run without any hindrance. I greatly appreciate all of your time and allowing me to show you the model that I have created. Once again, thank you for your time and your attention.